atrio? Yeah, it's an indentation that separates atria from the ventricles. Okay, so it's going to kind of go around the circumference towards the top. So as we look a little closer, what you're actually going to see is this big network of fatty tissue. And I can rotate it all the way around, and it goes all the way around towards the top. This is your atrioventricular sulcus right here. Okay, and actually underneath this, on the posterior side, is where your coronary sinus is going to be located. But you don't have to dig out all this fat, just that's where it's located underneath here. There's a lot of other small coronary blood vessels there as well. You should be able to differentiate anterior from posterior. And to do that, it's a little hard to see here, but this line right here is your anterior interventricular sulcus. Anyone know what blood vessels run down the anterior interventricular sulcus?
Yeah, the anterior interventricular artery.
Anterior interventricular artery and the great cardiac vein. Now if I flip it over and I kind of follow it to the posterior side, here's my posterior interventricular sulcus with the posterior interventricular artery and the middle cardiac vein. The plus is I'm not going to ask you about the arteries and veins, the coronary arteries and veins on the sheet part. The minus is I'm going to ask you on the models, so make sure you can identify them on the models, not so much on the sheet parts. But you can see the sulcus here. Of course, you got the apex down there, and then there's a bunch of structures on top that we're going to look at. Once you establish the front from the back, so you got the anterior and the posterior, what I want you to do is do a mid-frontal cut, mid-frontal section. So find about the middle and chop it in half. Okay. And this is what you get. You got a nice view of all four major chambers, and you can identify a lot of the internal anatomy of the sheet part. As you're looking closer at this, notice the thickness of the walls. Okay, here's the lower chambers are the ventricles, the upper chambers are the atria. Look at how thick these walls are here compared to this thin wall out here. Or same over here. Look how thin this wall is compared to this wall. Okay, the thicker wall is the left side. So this is my left ventricle right here because it's got super thick walls. This is my little right ventricle. Look at that thin wall right there. That makes sense.
Interventricular septum right there, the thickest piece, I guess.
Yeah, this piece here. We'll get to that. But it makes sense. The right ventricle has a small, thin wall. It only has to pump blood to the lungs. Here's the heart, there's the lungs. Real quick, real short. But in the left ventricle, remember, it's got to pump the blood out the aorta through the entire body. Okay, and so it has to have much thicker walls, much stronger contraction to force that blood that great distance. Okay, and so first thing you should be able to differentiate is the left from the right side, very simply, just based on the thickness of the walls. Okay, now once you do that, then of course you have the different chambers. The bottom chambers are your ventricles, and then the top chambers are going to be your atria. And the way you identify the atria is look for the valves. Okay, here's the little chordae tendineae, you see the chords, and then the flaps are the AV valves. So the left side, so that means this is my bicuspid valve, and that means the chamber above my bicuspid valve is my left atrium. If I come over here, it's a little harder to see, but I open up my right side, and here's my tricuspid valve right here. And that means this cavity up in here is going to be my right atrium. So right ventricle, right atrium. Left ventricle, left atrium. Okay, so, and then of course there's a bunch of internal structures. You mentioned the interventricular septum, okay, the trabeculae carnae, papillary muscle. Those are some parts that you're going to be looking for and trying to identify. Then we have the blood vessels that go to our different chambers. So those are mostly going to come out of the top. See these openings in the top of the heart. So we got to determine which blood vessel is which based on where it's going to. So here's an opening in the top, and it's going through which chamber? Yeah, it's my left atria right here. Right here is my left atria. And this is coming into the left atrium. So that means this opening right here, left atrium, what comes into my left atrium? Pulmonary veins. So these are my pulmonary veins right here. Big opening right there. Let's look over here. Here's my left ventricle. And then from my left ventricle, there's a blood vessel right here. I'm going to zoom into this guy. My left ventricle, and it comes up, and this is the start of my aorta. I cut right through the aorta so we can see into it. But you see these little flaps right here? Those are my aortic semilunar valves. Okay, so you should be able to identify those, and that goes into the aorta, which will extend up and out. And that's from my left ventricle, straight up here. What about this little hole right here? Well, let's put the probe in it and see where it comes out. There's where it comes out right there into my right atrium. Coming out the top is my superior vena cava. There's another hole right here. Let's put the probe in and see where it comes out. Also coming out of the right atrium. It's a little more lower, a little more inferior. It's my inferior vena cava. So I got a probe here. I can put another one right here. They come out the same location. Superior, inferior vena cava, right atrium. Okay, so that's what you're going to be doing. You're going to, as you get it cut open and you start identifying these, then you're just going to start sticking your probe in these different openings and trying to determine which is which, based on where they're coming out of. Okay, so as you do that, you say, okay, left atrium, that means this is my pulmonary vein. Over here is one coming into my right atrium from the top, superior vena cava, aorta, pulmonary trunk. Those are your main blood vessels that you're going to be identifying based on the chambers that they go into or out of. Okay, and so you're going to do a mid-frontal, try and get as close to the center as possible. It gives you a better look at all four chambers. Plus then you'll have two halves and you guys can share. So get in your groups. We should have enough. How many are